What if I told you that some of the very medications people take every single day for years, believing they are protecting their health, could quietly be harming their body over time? This is not about fear, this is about awareness. As a doctor with decades of experience, I've seen patients who were doing everything right, taking their prescribed medications regularly, yet they slowly developed new problems: fatigue, digestive issues, memory decline, kidney stress, even heart complications. And when we looked deeper, the cause was often not the disease, but the long-term use of certain medications. Now listen carefully. Medications are life-saving when used correctly. They are essential in many conditions, but some drugs are meant for short-term use, yet people unknowingly continue them for months, even years. Today, I'm going to walk you through medications that should not be taken long-term without proper medical supervision, and more importantly, what safer, natural alternatives may help support your body. Let's begin with one of the most commonly overused categories: painkillers. Millions of people rely on over-the-counter pain medications for headaches, joint pain, back pain, or general discomfort. At first, they seem harmless. You take one, and within minutes, the pain fades. But what most people don't realize is that frequent long-term use of these medications can silently damage your stomach lining, leading to ulcers or bleeding. Over time, they can strain your kidneys and even increase your risk of heart problems. I've treated patients who came in with severe stomach pain or kidney issues, and when we traced their history, we found daily painkiller use for years. Pain is a signal from your body, not something to silence forever. Instead of depending long-term on these medications, it's important to address the root cause. For many patients, simple lifestyle adjustments like improving posture, gentle stretching, weight management, or anti-inflammatory foods can reduce pain naturally. Even practices like physiotherapy or warm compresses can significantly reduce reliance on pills. Now let's talk about another widely used group: acid reflux medications. These drugs are often prescribed for heartburn, acidity, or indigestion. And yes, they are very effective in the short term. They reduce acid, giving quick relief. But here's the problem: your stomach acid is not your enemy. It plays a vital role in digestion, nutrient absorption, and even protecting you from harmful bacteria. When acid is suppressed for too long, your body starts to struggle. Nutrient deficiencies, especially vitamin B12, calcium, and magnesium, can develop. This can lead to fatigue, weak bones, and even nerve problems. I've seen patients who were taking these medications for years without reassessment. They didn't realize that their ongoing fatigue and weakness were connected to reduced nutrient absorption. Often, the real cause of acid reflux is not too much acid, but poor eating habits, like eating too fast, overeating, lying down after meals, or consuming trigger foods. Simple changes, like eating smaller meals, avoiding late-night eating, reducing fried and spicy foods, and maintaining a healthy weight, can dramatically improve symptoms without long-term medication. Now, let's move to something even more concerning: sleeping pills. Sleep is essential. Without it, your entire body suffers. So when someone struggles with sleep, it's understandable they want quick relief. Sleeping pills can seem like a miracle solution, but over time, your brain becomes dependent on them. Instead of improving natural sleep, these medications can actually disrupt your sleep cycle. Patients often tell me, "Doctor, I can't sleep without this pill anymore." And that's exactly the problem. Long-term use can lead to memory issues, daytime drowsiness, reduced focus, and even increased risk of falls, especially in older adults. Healthy sleep is not created by a pill. It is created by habits. Your body has a natural rhythm. When you respect that rhythm, by maintaining a consistent sleep schedule, limiting screen exposure at night, reducing caffeine, and creating a calm bedtime environment, your sleep begins to restore itself. Now here's another category people rarely question: laxatives. Many individuals suffer from constipation and turn to laxatives for quick relief. Again, occasional use is acceptable. But long-term use? That's where the danger lies. Your intestines are muscles. When you rely on laxatives regularly, those muscles become lazy. Over time, your body forgets how to have a natural bowel movement. This creates a cycle of dependency that becomes very difficult to break. Instead, focus on what your digestive system truly needs: fiber, water, and movement. Simple changes like adding fruits, vegetables, whole grains, and walking daily can restore natural bowel function. You see, the pattern is becoming clear. Many medications are designed to treat symptoms, not root causes. And when used long-term without addressing the underlying issue, they can create new health problems. But we are only getting started, because there are even more medications, some extremely common, that people take daily without realizing the long-term risks and the natural, safer approaches that can truly transform their health. In Part 2, I will reveal those critical medications, explain the hidden dangers, and guide you toward doctor-approved, natural alternatives that can support your body safely and effectively. Now let's continue, because what we're about to discuss next may be affecting millions of people silently, every single day. Let's talk about blood pressure medications. Now please understand this clearly. High blood pressure is a serious condition. It must be controlled. Medications can be life-saving, especially in moderate to severe cases. But here's what many people misunderstand. Some patients are started on medication, and then they remain on the same dose for years, without ever addressing the root causes of their high blood pressure. Over time, this can lead to unnecessary dependency, side effects like dizziness, fatigue, electrolyte imbalance, and even kidney strain. As a doctor, I always tell my patients, medication controls blood pressure, but lifestyle can reverse it in many cases. High blood pressure is often driven by factors like excess salt intake, chronic stress, obesity, lack of physical activity, and poor sleep. I have seen patients reduce, or in some cases, safely come off, their medications under supervision simply by making consistent lifestyle changes. Daily walking, reducing processed foods, managing stress through breathing exercises, and maintaining a healthy weight can have a powerful effect on blood pressure. Your body wants balance. You just have to support it. Now let's move to another commonly overlooked category, antibiotics. These are powerful, life-saving drugs when used correctly. They fight bacterial infections effectively, but they are not meant for long-term or repeated unnecessary use. Here's why. Your body contains trillions of beneficial bacteria, especially in your gut. These bacteria support digestion, immunity, and even mental health. Frequent or prolonged use of antibiotics destroys not only harmful bacteria, but also these beneficial ones. This can lead to weakened immunity, digestive issues, and increased resistance, meaning that future infections become harder to treat. I often see patients who take antibiotics for minor issues or stop and restart them without proper guidance. This is extremely dangerous. Instead, antibiotics should only be used when truly necessary and always completed as prescribed. To support your body naturally, focus on strengthening your immune system. Nutritious food, adequate sleep, hydration, and maintaining gut health with natural probiotics like yogurt can make a significant difference. Now let's discuss something many people don't expect: anti-anxiety and antidepressant medications. These medications can be incredibly helpful for those struggling with severe anxiety or depression. They can stabilize mood and improve quality of life. But long-term use without reassessment can sometimes lead to emotional numbness, dependency, and difficulty stopping the medication. Mental health is deeply connected to lifestyle, environment, and internal balance. I've worked with patients who improve dramatically by combining medical treatment with therapy, physical activity, social connection, and mindfulness practices. Your brain is not just chemical, it is responsive to how you live your life. Simple habits like daily sunlight exposure, regular movement, talking to someone you trust, and practicing relaxation techniques can significantly improve mental well-being over time. Now, let me share something very important. This is not about stopping your medication suddenly. Never stop any prescribed medication without consulting your doctor. This is about awareness. This is about asking the right questions. Do I still need this medication? Is there a safer long-term plan? Can I support my body in a more natural way? Because true healing does not come from suppressing symptoms forever. It comes from understanding your body. It comes from making small, consistent changes that support your health every single day. Your body has an incredible ability to heal, adapt, and restore balance, but only if you give it the right conditions. Eat real, nourishing food. Move your body daily. Sleep deeply. Manage stress with intention. Stay connected with people, with purpose, with yourself. These are not just lifestyle tips. These are powerful medical tools. And as a doctor, I can tell you, Patients who embrace these habits often need fewer medications, recover faster, and live healthier, more vibrant lives. So the next time you reach for a pill, pause for a moment. Ask yourself, not just how to silence the symptom, but how to truly heal the cause. Because your health is not built in a pharmacy alone. It is built in your daily choices. Take care of your body, and it will take care of you. This is the wisdom of medicine that lasts a lifetime.